I have the honour of introducing our next speaker, Margareth Broodkoorn, Chief Nurse Officer, Ministry of Health. Presentation title, State of the World's Nursing Report 2020, Its Relevance in a COVID-19 Health Context. Margareth, who is of Māori and Dutch whakapapa descent, and I must say, Whaia, you must like tuna. Just an assessment of mine. Margareth is proud to be a New Zealand registered nurse with a career that includes clinical practice, leadership, operational management, strategic, governance and education roles within Aotearoa, New Zealand. Appointed to the Chief Nursing Officer's role with the Ministry of Health in February 2019, Margareth was formerly the Director of Nursing and Midwifery at NDHP. Prior to this, she has worked with Māori health and community providers in Northland and possibly with Ngāti Hine Health, Manukau Institute of Technology and Auckland University, nursing practice and leadership roles with Auckland DHB. With over 30 years of experience in the health sector, Margareth is committed to Te Tiriti o Waitangi, addressing Māori health inequities, improving access to health services for all consumers, and developing an enabled, responsive, culturally safe workplace. She is passionate that nursing can make a significant difference in achieving equity in health outcomes across Aotearoa, with a sustainable future-focused nursing workforce that leads change and innovation in partnership with the wider health team. Nō reira e te iwi, anei a Margareth Broodkoorn. Tēnā koe whaia.
Tēnā koe Keelan, kia ora koutou katoa. I ngā mana, i ngā reo, i ngā karangatanga maha, tēnā koutou, tēnā koutou, tēnā koutou katoa. Reiranga tēnā mā, tēnā koutou. Nō ko te honorea kia haere mai ki te whakanuia tēnei huihuinga, ko te kaupapa rangatira e tauhere ana i a tātou katoa, ko te whakapiki i te oranga o ngā tangata katoa o Aotearoa. E hare te mahi māma, engari me mehea ka mahi tahi tātou, ka taia e tātou, ko te tūmanako kia angitu tēnei hui. Ko ai au, ko ngāpū te iwi, ko no hokianga au. He mahi ana ahau, te tāpoi rangatira o Manatū Hauora, ko Margareth Broodkoorn tōku ingoa. Nō reira, tēnā koutou, kia ora koutou katoa. Kia ora anō, thank you for the invitation to speak today and provide the closing kōrero for your conference. I just want to acknowledge Keelan, our kaimātua for the hui today, the new President, Heather, Kai Whakahaere Kiri, CEO Memo, and all the new board members and existing board members. To the previous speakers of the day, I've managed to capture most of the hui today and some wonderful speakers and some kōrero that has been provided and shared. And I also want to acknowledge the hui participants that have been online today. There's been an amazing hui thus far. Actually, I'm still yet to speak, but in terms of the day, the hui, the kōrero, and also in the context of COVID and undertaking a conference in this context by Zoom, by webinar. Well, technically, I'm not quite sure exactly what this one is, but just wanted to say kia ora to you all. And I just wanted to acknowledge that the kaupapa of the hui, the community wellbeing in Aotearoa, Nursing 2020 and beyond. And I think it was Kiri this morning that mentioned that was the kaupapa or the theme that was set prior to in the early days of the planning, and just acknowledging that it is still obviously relevant more so now with the advent of COVID-19. And I wanted to commence and acknowledge nurses across Aotearoa and acknowledge the contribution that everyone is making, that everyone makes every day, and the mahi that you do makes a difference in people's lives every day. And you know, and I think Howard said previously that as we commence the year, prepared to celebrate 2020 as the year of the nurse and the midwife, but as we know, the year changed extremely rapidly. And so in terms of the context of COVID and nursing in the COVID context, and I think just recognising what Howard was saying previously around that critical importance of nurses has been brought sharply into focus. And as we commence this new decade, we would never have imagined that 2020 would be in the grip of a global pandemic. Nurses internationally and in New Zealand had envisaged and planned for a very, very different year. But again, I wanted to sort of acknowledge what had been said by the previous speaker, by Howard, that although COVID-19 has dominated this year, it has provided us with an opportunity of clearly articulating, of highlighting the contribution that nurses make within this context. So again, thank you to all the nurses around the motu. I want to mihi to those healthcare workers that have lost their lives in the course of duty. I want to acknowledge those healthcare workers, our nurses at the front line and overall COVID responders. And also wanted to acknowledge those 172, I believe at this point in time, in Aotearoa, New Zealand, that have been actually infected by the virus and the impact that it's made on their lives and their whānau. Having said that, though, I think 2020 is still a very special year. We've got a lot to learn from this year, but I just wanted to take a quick moment to say that from a personal perspective and professionally, there have been some great moments for this year. In February of March, I was at the birth of my two grandsons, 2 separate months, my grandsons, and on the 12th of May, we celebrated International Nurses Day, and of course all the other celebrations that have been undertaken to date in terms of how we've celebrated nursing in Aotearoa. Again, from a COVID context, as I said, the critical importance of nurses were brought sharply into focus this year. Our nursing response, we've been working together and collaboratively and urgently to respond to COVID-19. In Aotearoa, we've taken services directly to whānau, which has been just a fantastic response. And in Taitokero, when working from home, as many have done in this time, I received a whānau pack from Ngāti Hine Health Trust, which with lots of little goodies and sweets and a little taonga within this little pack. It was a wellbeing pack, and also COVID has highlighted that there have been we have vulnerable communities in terms of aged residential care, Māori and Pacific peoples and rural communities that we have been mindful of, and actually ensuring that we the unintended consequences, but also that we don't create more inequities by the activities that we're undertaking, but to acknowledge those vulnerable communities. Howard also touched on previously a little bit about the State of the World Nursing Report. First of its kind, and 2020 being the year of the nurse, it was obviously quite important that we had this report, a collation of a number of data that brought together a global picture of nursing, of the nursing workforce and its contribution to the 3 billion goals. So on the 7th of April this year, which was the World Health Day, the SOWN 2020 report provided the latest, most up-to-date evidence on policy options for the global nursing workforce. It presents a compelling case for considerable and yet feasible investment in nursing education, jobs and leadership. The report was developed in collaboration with ICN and the Nursing Now campaign. It describes how the nursing workforce will contribute to the universal health coverage and the sustainable development goals, and highlights areas for policy improvement and development. The key objectives of the goal provide a global picture of the nursing workforce, inform policy and nursing workforce strategies at a national level, speed up the progress of the SDGs, increase investment in nursing, in the health workforce and gender equity agendas. And highlight the critical contribution of nurses in achieving the WHO's 3 billion goals. The data collection process included sourcing information from national health workforce accounts, and we're the main platform for data collection and sharing. And there were contributions from, in New Zealand, Nursing Council, Ministry of Health contributed. We sourced information from Ministry of Education, education employers, and population surveys and professional associations. So it was a joint effort and a collaborative effort from our part in Aotearoa to provide that data for this global report. In terms of the next steps, we need to ensure that policy dialogue at a national, regional, global levels take into account the outcomes and the recommendations of this report, and decision-making and further investment in the nursing workforce obviously is required and has been highlighted in some of the previous speakers that have presented today. This slide is the SOWN, the State of the World Nursing Report Theory of Change, and essentially the graphic from WHO demonstrates that the report is not the final outcome, it's not the final goal, but it's actually a start of something great. It's part of a much wider project of achieving sustainable, positive change on a global, regional, national levels. In terms of the country profiles, the country profiles provide some technical overviews of the nursing workforce at national levels. It includes information such as the number and types of nurses, education frameworks, regulatory and regulation, leadership and gender issues. In terms of the priorities for governments, which the report highlights, there are 3 key priorities, and the data and the evidence from the report has highlighted these key areas of concern. The report identifies 3 priority areas, as I've said, areas for national governments in order to contribute to global efforts and to address these concerns. Here is New Zealand's data. And this is our New Zealand country report. It's a bit busy and you may not be able to see the level of detail in this, but it is available on the web, and we can certainly send that out to you if you don't have access to it. So this is our country report. And as I said, lots of information here, but the data of note includes that in New Zealand, nurses make up 68% of the health workforce. Our midwifery colleagues are 3.3 of the total health workforce. In New Zealand, as at the data I think was for 2019, the international qualified nursing workforce in Aotearoa is 27.25%. Approximate ratio of female to male ratio is 9:1. The total number of nurses at that point in 2019 when we provided the data was around 56,500. As you may know now, in March of 2020, with the updated Nursing Council data, there is now over 60,000 nurses in Aotearoa, New Zealand. The report also provides some country capacity in terms of our regulatory and regulation of education and practice and working conditions, and it also identifies nurses involved in governance and leadership, and noting that in New Zealand, which I believe we're very fortunate to have, a Chief Nursing Officer in the Ministry of Health at the executive level reporting to the CEO or the Director General of the Ministry. Having been in various forums with my international colleagues, my global colleagues from the Pacific and from countries from around the globe, many other countries do not have leadership at that level, and you can see the impact that makes, and all the poor impact that makes in terms of policy decision and influence. As I said, we had Nursing Council, NZNO, Midwifery Council and the Ministry supply data for the WHO report. Now, in terms of the report itself, there are 10 key actions which they're in front of you on the screen, and I'll just talk to a few of them. So globally, there's around 27 million nurses across the world, and the report writers conclude from the data supplied in the report that there will be a shortage of around 5.9 million nurses by 2030. Initially, we had indications of around 8 to 9 million. That this report verifies that we've got about a 6 million shortage by 2030, and especially in low-income countries. So, therefore, investments in the nursing workforce can also help drive progress in job creation, gender equity, and youth engagement. Good nursing data will help drive evidence-based policy development and investment decisions. International nurse mobility should be monitored and regulated to ensure adequate supply to meet health system demands. Government chief nurses can help with this as well as national stakeholders. Actions include, if we think about number 4, we're in terms of nursing education and training programs, actions include investment in nursing faculty and clinical placements and ensuring we've got good quality clinical placements, and aligning nursing curricula with national health policy. We look at number 5, nursing leadership and governance is critical to strengthen our nursing workforce. So supporting and having a chief nursing officers at all levels of healthcare delivery, not just at the ministry, but at all levels and all healthcare organisations, but also taking into account we also need to nurture our young nursing leaders and upcoming nurse leaders. Number 6 is around planning and planners and regulators optimise the contributions of nursing. And this includes nurses enabled to work to their full breadth of scope and supporting nurse-led models of care. Number 7 is around policymakers, employers and regulators coordinating actions in support of decent work. And so in this space we're looking at safe staffing and prioritising and enforcing occupational health and safety measures. And 8 countries plan for gender-sensitive nursing workforce policies. So what we're doing is looking at that gender pay gaps in this country, as well as pay parity in terms of Māori Pacific providers and other settings. We needing to look at flexible and manageable work hours, given that nurses are overwhelmingly and predominantly women. And Section 9 professional nursing regulation must be modernised. So we need to develop internationally interoperable systems of recognition of nursing education and professional credentials. And the final key action from the report is around collaboration. That collaboration is key. So we do need to work together across parts of the system as a very important element for New Zealand just now. And to some extent we've seen that happening through the COVID response. Certainly there's other opportunities and further opportunities to enhance that collaboration. So collaboration across government with relevant ministries, for example, education, to consider and for consideration around our undergraduate nursing education, working with MB in regards to immigration and supporting those processes, and stakeholders from private and public parts of the health sector. We also have a national nursing leaders group, and where we have representatives from peak bodies, and I'm really proud of that group and the formation and the further development of that group by way of having a bicultural partnership with members of the group, and each organisation brings their Te Tiriti partners to the table. And also there is some fantastic work that's happening in the workforce pipeline space around supporting the undergraduate mahi that's needing to occur. The implications of the SOWN 2020 for Aotearoa New Zealand. Now, and on this slide, I'm just referring to Linda Chalmers, is a nurse educator and researcher, developed and wrote an article that's in the Nursing Praxis in Aotearoa New Zealand publication, and I really encourage you to read it. It makes some good reading around what's missing in the SOWN report, and she makes comments that and highlights some of the priorities that we need to consider, not only consider but to move forward in terms of that we need a coherent nursing workforce strategy in Aotearoa. We've got various strategies that have been developed over time in various organisations, even at DHB level, and other providers at NZNO has a strategy. We've got various strategies, but what we need is one national strategy that brings that all together, and a coherent nursing workforce strategy. And again, working in collaboration with all those interested and key stakeholders to ensure that we've got a strategy document that is going to hit the mark. Prior to COVID-19, that was on the radar. That's what we're aiming to achieve this year as part of 2020 Year of the Nurse. And that hasn't gone off the table, and we are still looking and exploring what is important that goes into that document. So that's one thing that Linda identifies in the paper, as well as, of course, is highlighted in the SOWN report. The paper also makes reference or refers to the fact that the paper the SOWN report is silent on the international Indigenous nursing workforce, and certainly there's other elements within this paper that within the report that we need to be cognizant of. And whilst it doesn't identify the Indigenous nursing workforce issues that many countries have, what it does highlight is that we need to be really careful around investing in the domestic market, and instead of continuing to rely on the immigration of internationally qualified nurses would be unethical, which is what the report identifies. So in terms of New Zealand, we've got nearly 30% of our workforce are internationally qualified nurses who contribute fantastically to our country and our healthcare system. But the report does make mention of that we need to be cautious, so we need to be careful around the ethical utilisation of internationally qualified nurses or drawing upon other countries' workforces. And certainly when I was at another global hui, where one of the nursing leaders were very adamant around calling on other countries not to take their nurses because they need them at home. And so I think that's also a very pertinent point too that we need to take heed of. So in terms of other things that, in terms of the implications of the SOWN, the State of the World Nursing Report, and what that means for us in Aotearoa, New Zealand, that we need to ensure that the nursing workforce policy is aligned and to the achievement of the SDGs and the universal health coverage. And certainly that will be taken into account in terms of ensuring that we, in terms of eradicating eradicating poverty, achieving good health and well-being, ensuring inclusive and equitable education, etc. And also that universal health coverage means access to quality care is fundamental to population health and health equity, and recognises the role of primary health care to achieve this. All of those things we're not going to argue with. It's absolutely pertinent. When we think about the detailed and transparent nursing workforce data collection analysis, data in New Zealand currently is incomplete, and we need to ensure that we've got better information and the characteristics, noting we need better information on characteristics and trends in the undergraduate nursing pipeline. In terms of, again, in 3, we need to invest in domestic production of nurses. The SOWN report recommends responsibly monitoring nurse mobility and migration to prevent continued maldistribution of nurses for underdeveloped countries. And then finally, in terms of number 4, advance accountable leadership and nursing education. We need to include in the urgent development of coherent national nursing workforce strategy, which is what I've mentioned. And then the fifth point is around joint intersectoral collaboration and action. So we need to look at advancing investment and intersectoral collaboration for the nursing workforce. Again, all of those things you're not going to hear any arguments from me about. So in terms of New Zealand policy and future policy challenges, these are some of the things that have been highlighted on this slide. So the data provided for the report reveals some potential areas for improvement in New Zealand, and I'll just let you scan those in terms of recruitment, safe staffing, mental wellbeing of nurses, enabling regulatory and legislative systems, and the retention of nurses. And I'll just move forward. I wanted to say a little bit more about that, but I'll just move forward into the next slide and just sort of highlighting that, again, just highlighting our current nursing workforce in terms of our 3 scopes of practice, our registered nurses, our enrolled nurses and NPs, and some of the highlights of this particular slide, although there's some lowlights, of course, but as of March 2020, we had our Nursing Council data showed us that the nursing workforce had increased by more than 10% from 2017 to 2020. That we had an additional nearly 6,000 extra nurses, additional nurses with APCs than 3 or so years ago, and that the numbers of NPs have increased by 90%, which is fantastic news. And in terms of our nursing workforce, and just sort of keeping sort of a look and an overview about some of those challenges, and noting that our nursing workforce will keep pace with population growth over the next 10 years if current entry and exit patterns continue. However, COVID has had an impact on that in terms of our entry and exit patterns, of course, in terms of our internationally qualified nurses and those that are coming to New Zealand to practice. There are noted that some practice settings and regions show a decline in the ratio of nurses per population. So our Ministry of Health modelling shows that growth in the total nursing workforce will keep pace, as I said, and the declines in the ratio of nurses per population and some of those practice settings, particularly in rural environments and in primary healthcare. And some of those factors that influence the demand and supply, for example, global labour markets, models of care, wage settlements, change in immigration settings which are currently volatile and affecting the accuracy of longer-term forecasting. And of course, we've also got COVID-19 in the mix, which is actually another major factor that's influenced demand and supply. So if I think about over the 2020 to date and the 9 months to date of 2020 and the SOWN report and what it's advising us and the recommendations. We have some work to do, there's no doubt about that, but I'm confident that in the time that I've been in the Chief Nursing role at the Ministry, there has been some good investment in nursing. There could be more, and certainly there's a lot more to do. But if I think about the work that we're doing with the Accord, I think about the investment that's been made for mental health nurses, if I think about the ACE program and the investment we're making in enrolled nurses and nurse practitioners, we are moving towards further investment in nurses in Aotearoa, New Zealand. So I just wanted to probably bring to my kōrero to a close, noting that over the last couple of years it's been a fantastic opportunity to, and certainly with the release of the SOWN report earlier in this year, to inform and to continue forward with the development and investment in nursing in Aotearoa, New Zealand. I also thought I'd also highlight in this kōrero that in the last 2 years has been an amazing journey, but all journeys to some extent comes to an end. And I'm sad to say that as a chief nurse, I have resigned from the role as the Ministry of Health for no other reason but to return home. Here is Hokianga Harbour and our taniwha waiting for me to come home, but I have accepted the role as CEO at Hawara Hokianga, and I've got up there, maybe want to add photos of my whānau and moko, but I didn't have time to, I'm sorry. But I just wanted to say that I'd hoped to be in this role for 3 years, at least 3 years, 3 to 5 years, to ensure the implementation of a workforce plan and such, which I will hand over to the next person that's appointed to this role. But I just wanted to say it has been an absolute, by the time I finish in this role at the end of this year, it's been an absolute pleasure to be the chief nurse of this country. The investment that this government and hopefully going forward will continue to make in nursing in New Zealand. As I've said, we've got some way to go yet, but I'm confident that things are in good hands. For those of you that are online and listening, you will make a great contribution to nursing, to health, to improving health outcomes on a daily basis. And whilst I may be in a CEO role, I still will maintain my practicing certificate because our health service has nursing services, as all good health services do, and I will continue to practice, and you haven't seen the last of me. So ngā mihi nui ki a koutou katoa. Kia ora koutou. And here's just a photo of some of us at the beginning of the year celebrating International Year of the Nurse and the Nursing Now campaign on the steps of Parliament, which brings back fond memories because we were told off by security we weren't allowed to be there. But kia ora, ngā mihi nui ki a koutou katoa.
Hey, ngā mihi kia koe e whae Margaret. I mua I taku haerenga mai ki konei, I tū au ki taku kāinga, I te mea I hinga te o aku matua. I nanahi, I whakahoki a rātou I aia ki mangamuka, ko te whānau bāba, a Terry Tanaingwa. Engari, e mihi kauatu ana kia koe mo tō whakaaro rangatira kia oti tēnā o nā mahi kia hoki koe ki o iwi, kia hauora hokianga, kia whakapau karakia, kia ārai te uru, me ana taniwha. And all I really want to say to you for your report and your presentation today was just amazing. And I just want to say thank you to you for contributing to the pursuit of Māori ora for whānau, for hapu and iwi. E mihi ana kia koe. I have a couple of questions here for you. What strategies are being considered to address the pay equity gaps between Indigenous nurses and non-Indigenous nursing groups? For example, in Aotearoa, iwi provider nurses are paid 25% less than their PHC and DHB colleagues. We are nurses who make significant changes for Māori. And I guess you'll be in that position too when you go home to Hokianga Hauora.
Kia ora. Certainly, and yes, I will be experiencing that reality, although, as I understand, Hauora Hokianga does actually recognise the value of their staff by paying accordingly. But in terms of the question at hand, it's a very important question, and I know that we haven't had an outcome to the questions that have been raised by NZNO and by Kerry and the team, and we have continued to look at opportunities to address those issues, and in terms of pay parity and pay equity, which is quite separate but somewhat related, that we continue to work in working with our Māori Health Directorate, with the Māori Workforce team, and continue advising that something needs to change in that space. I can't actually stand here today or sit here today and advise that we've got an outcome to that, but I do need to reassure that there is work happening to ensure that we get to a point in time that actually is addressed.
Kia ora whaia. Next question is, some nursing students are going to graduate late as a direct impact of COVID protocol. How is this going to be better managed in the future given the current forecast of nurse shortages in the future?
Well, that's a really important question, and a mihi to those tauira and students that are actually online. The directors of nursing, our National Nursing Leaders Group, my team at the Ministry have been working, and our nursing educators have been working closely with Nursing Council to ensure that our tauira, our students, haven't been disadvantaged by the impact of COVID. There are mechanisms in place by way that when they do complete their state exam and they are registered, that they do apply to the ACE process, and that the talent pool or those that go into that process, that there are actions in place to ensure that we meet the aim of what we've set ourselves through the Accord around employing 100% of our new graduate nurses. So while there may be a delay in getting there, we're still committed to employing 100% new graduates, and I know that the directors of nursing are working on strategies at this point in time to support new graduates entering and being part of the COVID response.
Just a couple more questions from the floor. From Linda Mahika. Kia ora, Margaret, from Te Tautokero also. Thank you. Do you think it should be free to train as a nurse, given the huge shortages of nurses in 2030?
Kia ora, Linda. No, long time no see. We'll be seeing each other soon. Yeah. I wouldn't discount that, and I wouldn't disagree with that. In terms of the support for if we are going to be serious around increasing our domestic market, as the SOWN report refers to, if we're serious about investing in nursing, then yes, because we know the burden and the cost burden and other elements that challenge those that are entering education and tertiary education. So certainly that would be a dream to achieve for me. I won't be able to do that, of course, in the time remaining in this role, but certainly I think that's a really good suggestion and something that I'll forward on to our Ministry of Education whānau.
Kia ora. And one of the last here from Iseta. Kia ora, Margaret, and best wishes from the Pacific nurses, and thank you for your report and your support, much appreciated. And the very last one is from Moana Te Iho, sorry. Thank you, Margaret, for that kōrero about pay parity for iwi providers. Nō reira whaia, tēnei te mihi anō kia koe, kia whae wā, te mutunga o te rā, te kōrero kia tātou e pāne ki tēnā kaupapa ngiha nui, kia tātou katoa o tira tau. Huri no, tēnā koe, tēnā koe, tēnā koe mā te ngā kau i tirawa kia pai tō rangi. Hei kona.
Ka kite.